Welcome to Motherhood Diaries, previously known as Pregnancy and Birth Diaries. I just decided to go with something shorter and something that encompasses a bit larger array of topics. So I'm quite excited to share my experience and what I have learned and what I'm about to learn as a mother of two. Today, I want to talk about how long after birth it takes for our menstrual cycle to resume and why it might take a long time for us to get back to our normal cycle. Now, obviously, we all have different bodies and different birth, so it's going to be different timeline for each of us. Especially, it depends on factors like are we breastfeeding, um, what kind of birth we had, do we have drastic hormonal changes, and what is the state of our overall health. So, for non breastfeeding moms, if you are not breastfeeding, your period will start usually 6 to 8 weeks postpartum because once you give birth, your placenta is delivered and the levels of estrogen and progesterone stabilize, and your body starts shifting back to your pre pregnancy state. And for the breastfeeding moms, it will take a bit longer normally because when we breastfeed, a hormone called prolactin is at a heightened level in order to support milk production, and that hormone suppresses ovulation. So if you do not ovulate, then obviously there's no period. So if you are breastfeeding, it might take about 6 months or longer, and it often coincides with the time when you start introducing solid foods to your baby. And this specific phenomenon is called lactational amenorrhea. Having said that, I personally did exclusively breastfeed my firstborn for almost a year before I introduced solids, and my period came back exactly in 40 days postpartum. And the second time, in about 2 months after birth, even though I was also breastfeeding. So this timeline is not always accurate. And it depends on different factors like your overall health, your body weight, stress. Stress is very important. I don't mean regular stress, like day to day stress, but something big. So that affects it. And of course, hormonal changes. Okay, so to wrap it up, some women will have their cycle return within weeks, while others might have a delay of up to 1 year or more, especially as I mentioned, if you're breastfeeding exclusively. Now, our first periods postpartum might be irregular, heavier, or lighter than our pre-pregnancy cycles, but that should go back to normal usually within a few months. Now, it's very important to keep in mind that during pregnancy, we have heightened levels of progesterone and estrogen, which prevent ovulation and menstruation. However, after birth, these hormone levels drop, and that allows the reproductive cycle to restart, to resume. And what's important to remember is that ovulation happens before we get our first postpartum period because our body, as usual, prepares for pregnancy. The endometrium, the walls of our uterus thickens, and eggs mature and travel down the tube to be fertilized. And when it does not happen, your body understands that there is no pregnancy and sheds the uterine lining and wraps up the whole process, and gets rid of the tissue. Uh, so it's going to be like a blood and mucus, which is what was called menstruation. So it's very much possible to get pregnant before you see your first postpartum period. That is why women not planning another pregnancy are advised to use contraception, even if they haven't had a period. Now, you might ask, well, if I breastfeed frequently and very well, that hormone prolactin is supposed to suppress ovulation. But the problem is, it's not a guarantee. And so breastfeeding is not a method of contraception. As I have mentioned, I got my period both times almost right away after giving birth, although I was breastfeeding. So yeah, now let's talk about what you should watch out for regarding postpartum periods. Of course, you are gonna have a scheduled appointment with your gynecologist, I think after a month postpartum. But still make sure to talk to your doctor if your period is heavy or painful, because some women might experience heavier bleeding or more intense cramps postpartum. And if these periods are like excessively heavy or prolonged, you should see your doctor and just check it out to have peace of mind. Now, while it's normal for cycles to be irregular in the beginning, it's important to check with your doctor if these irregularities are persistent, and also pay attention to signs like extreme fatigue, persistent bleeding, or unusual pain, which could signal conditions like anemia or retained placental tissue. Okay, I hope this was helpful. Thank you for watching and see you next time.